Hello, I'm Mady Ohs. I'm an OB/GYN at Norman Regional, and I'm so excited to be here today with one of my favorite people at Norman Regional. This is Christa.
Well, hi, I'm Christa Gatewood, and I'm a physical therapist that works with Norman Regional's outpatient rehab department, and I'm super excited to be here with Dr. Ohs as well to talk about our pelvic floor and many things that we in therapy can help with.
Yeah, so I see women in pregnancy. I also see women for their yearly well woman visits, other problems they have. So women talk to me a lot about what's going on with their bodies, things like pelvic pain, problems like leaking urine, difficulty going to the bathroom, just feeling like their pelvic floor is weak. And these are all things that sometimes after talking and getting to know you, we might decide that pelvic floor physical therapy could help. Do you want to talk about what is pelvic floor physical therapy?
Well, I would love to. So pelvic floor physical therapy is a specialized PT department within our rehab department, and it takes specialized therapists that work with specifically our pelvic anatomy, so bones, joints within the pelvis, as well as maybe your spine, and the muscles that sling from the pubic bone to the tailbone. So a lot of people are not aware of these particular muscles, and it's something that we as pelvic floor therapists take very seriously as far as how we can help with a number of those things that you just mentioned with pain or incontinence or even constipation, learning how to open the pelvic floor to help with that.
Yeah, and so many of my patients don't know that pelvic floor therapy is a thing, which is one of the reasons that I'm so passionate about being here today with you, because I just want women to know that this is something that may be able to help them. It's not invasive, it's safe. The things that women can learn from you are like lifelong to help them feel better. So whenever I do a pelvic exam in the office, I'll often check the muscles in the pelvic floor, especially if women have problems relaxing during their pelvic exam, or maybe you have complaints of pelvic pain. When I do my pelvic exam, I'll really gently feel in different areas with my finger and put pressure there to help you relax and to help see if those areas are really tender. And if those muscles really hurt during that exam, then pelvic floor physical therapy may be able to help with that kind of pain. Can you talk more about the muscles in the pelvic floor and what happens at the PT appointment?
Absolutely. So when a patient is referred to physical therapy and we are assessing for, say, pelvic exam pain, we want to make sure that all of the bones, perhaps the spine, the sacrum, are aligned. We want symmetry. So we do a full assessment of the spine and the pelvis, and then, with that, perhaps you do have a malalignment issue that would perhaps put some tension or undue stress or strain on the pelvic floor muscles, because these muscles, which we collectively call the pelvic floor, but it's a group of muscles, they form literally the floor of our pelvis, hence the term pelvic floor. And if there's undue stress or strain, we want to make sure that we correct for any alignment issues. Perhaps, Dr. Ohs, that they've had a previous surgery, perhaps a delivery that has created a scar tissue adhesion. And so with that adhesion, if it's adhering to any of the other tissues within the pelvic floor, that can be painful upon palpation or upon intercourse. So the pelvic floor, we really want to make sure that not only is the pelvic ring itself in good alignment, we want to make sure that the pelvic muscles themselves are strong but yet flexible. And so that's where the exam portion comes in with physical therapy. But the pelvic floor has a huge role that some people are not even aware of. It helps us maintain our continence, as well as, when we're looking for those areas of pain, perhaps it is a weakness. And there's tenderness. There's also weakness to the pelvic floor. So yes, the pelvic floor, we would want to make sure that the integrity of the pelvic floor is intact with our exam.
Okay, awesome. So a lot of my patients in pregnancy will have different aches and pains, or maybe leak urine, which can be really common. So do you see women in pregnancy too?
Absolutely. Yeah. And so I love that you use the word common, because the word common is what I use in my practice as well. So women are often told, because, perhaps their grandma, perhaps their aunt or their sister, they all experience this leakage of urinary, perhaps leakage, or even, you could have leakage of bowel. But with the term common, it is common. In fact, there are studies that show that 13 million Americans suffer from incontinence. 85% of those are women.
Okay.
And then 1 in 4 women between the ages of 39 and 50 do experience urinary incontinence at some point. And then when you think about women who have had children, there's a large number of women that have had children, 49%, in fact. So almost 50% of women who have had children still experience that urinary incontinence, even 5 to 7 years following delivery. And then when you think about that stat, on top of that, it takes them 5 to 9 years to even mention it to their physician, because instead of thinking that it's common, perhaps they think it's normal.
It's normal, yeah.
Right?
And that's such a bummer that so many of my patients will have not talked about it or done anything about, their leaking urine or the problems they're having, just because they think that it is normal.
Right. Grandma experienced it, and grandma wore pads and spent, by the way, billions of dollars are spent in America every year on, products to help us with.
Well, and I think people get embarrassed about it too, right? But you are not alone if you're experiencing this.
No,
right?
absolutely
you're
not.
You're just not talking about it enough.
And I feel like that's a disservice for our ladies. We need to be talking about it. We need to be talking with our physicians, our OB-GYNs, that, hey, this is an issue that I've been having, because yes, after delivering a child, most likely you're gonna.
We have our stories, right?
That's right.
That's right. Everybody has their story.
That's exactly right.
Difficulty controlling their bladder after that delivery, and
it's surprising.
We've all been there, but we're not talking about it. We don't know. And the other thing is, you need to know that this can help. Even personally, this really can help make a difference.
Right. So I've been a pelvic floor therapist for 20 years. My motto is Kegels for life. And it's obviously in pelvic floor therapy, it's, a little bit beyond just Kegels.
Yeah.
That is one of the key things that we do look at, is the strength of the pelvic floor contraction, or the Kegel. We're looking at the endurance of that muscle. So when I ask a patient to hold their Kegel for 30 seconds, they go, what?
Yeah.
Because it's not something that we normally do and think about throughout our day. When I ask a patient, how coordinated is your pelvic floor? Again, I'm asking for a particular contraction of the muscle group, that once they understand the role of the pelvic floor and how that helps to control their bowel and bladder, because as you and I talked about, we don't actually have direct control of our bowel and bladder, right? It's under a different nervous system. The bowel and bladder is indirectly controlled by the pelvic floor. So I call it the great communicator.
Okay.
So when I'm talking with your patients, when you send those patients to me and I'm in the treatment room with them, I'm talking about the great communicator, their pelvic floor, and how that is used to control those bowel and bladder functions. So that's one of the things that I love discussing with patients and teaching patients. It's a lot of education. We talk about sex, because sex is an important role of the pelvic floor. So when I'm asking a person that you may send to me about maybe pain with intercourse, if you've touched their pelvic floor and that hurts, imagine perhaps what intercourse might feel like to them. And so we talk about intercourse. We talk about, are you avoiding intercourse? Because me, as a physical therapist, I want a woman to live her best life. And if intercourse is important for her, which, as if you're in a relationship, that is important, then we need to make that comfortable for them. Menstrual cycles, a woman that can't put a tampon in, that is, that's annoying. There's ways that we can help to teach the pelvic floor to relax, perhaps to better insert a tampon, or to be able to engage in intercourse without it being painful, or to be able to come and have
just your yearly pelvic exam. I don't want that to hurt. I know it's not the most comfortable thing, but we want to be able to help you relax and kind of control those muscles.
And so, we've talked a lot about the pelvic floor and strengthening with Kegels, but relaxation, as you just mentioned, is extremely important. And when we know how to relax the pelvic floor appropriately, then we can better eliminate. And what I mean by that is if we go to the restroom to pee or to poop, I'm just going to say what it is. When we go to the bathroom to pee or poop, and if we can't relax our pelvic floor, then we're now straining. And then what can come of a straining, pelvic floor?
Hemorrhoids.
Exactly. Maybe it helps with the symptoms of prolapse. So if if I feel like things are falling out and now I'm straining,
it makes it way worse.
Yes. And so a lot of my patients that have had prolapse or complaints of something is down there, something doesn't feel right. And we talk about, their history, and they say, oh yeah, I've had constipation all my life. Oh, well, maybe that has led to, or has, made your prolapse even worse.
Definitely can exacerbate it.
Absolutely. And, most people don't think of hemorrhoids as a reason to refer to physical therapy. I mean, before becoming a physical therapist, would have never thought you go to a physical therapist for that.
Me neither.
But
it makes sense.
It makes sense.
When you think of how this all works together, when it's not coordinated or where there's that dysfunction there, then we're straining, then you get the hemorrhoids, the constipation, pelvic pain, and it all affects each other, right?
And so part of what I do is I talk with patients about coordination of their pelvic floor with the respiratory diaphragm. So learning how to use breathing techniques that would help us to open the pelvic floor more easily to go to the restroom. I call it the blow up a balloon, or perhaps blow bubbles. I've even recommended to patients to, go purchase some bubbles, and when you're sitting on the toilet, go ahead and blow some bubbles. And the results of that has been dramatic. Positioning on the toilet is also important. Everybody knows about the squatty potty. So we talk about the squatty potty. We talk about positioning and how that is helpful to open that pelvic floor up. Diet changes, of course. Water intake is important for learning how to have better bowel regularity. Because, as you are aware, with the nervous system, when we have constipation or hard stool, a lot of times that triggers our bladder to make us feel like we need to go to the bathroom more often.
You guys ever experience that, feeling like you have to pee all the time?
All the time.
It is not comfortable.
No. And how about you're in a meeting and you've got a 3-hour meeting and you're having to get up every hour maybe or two to go to the restroom? And
if that's normal for you, it doesn't have to be normal.
That's
common, but not normal.
That's right.
And this can help.
And so we talk about bladder retraining techniques and things that we can do to help the bladder understand that its primary job is that of a storage unit. It is meant to store bladder until you're at an appropriate place to go to the restroom. And so a woman, or a man for that matter, that seems to go to the bathroom frequently, we talk about why. Perhaps, if you think about it, if you start to experience incontinence, we'll say, and therefore you want to avoid that, right? Then you go to the bathroom at that first signal that your bladder wants to send to the brain. And over time, we don't even realize it's happening. Over time, the bladder understands, I'm not supposed to store that much anymore. So it has a new normal, right? And therefore, the new normal means that I have to now go to the bathroom more frequently. And so when I have men or women come into the clinic and they're saying, I'm going to the bathroom about every 30 minutes to an hour, man, and how about at night? If your sleep is interrupted because you're getting up to use the restroom 3-4 times at night, now you're grouchy during the day. You can't stay awake during your meetings. I mean, you don't even realize how the bowel and bladder affects every moment of our lives.
I mean, that's your quality of life. And something I was thinking about on my way here today was a lot of times we're not very good as women or people of making ourselves a priority. We take care of everybody else every day, right? And we sometimes like neglect ourselves or our own health. That was one of my goals in this 2021, was to try to make my own health a priority. So I scheduled an appointment with a PCP. I saw Christa. I realized that we need to do things for ourselves to be able to help take care of our families, to live every day.
Absolutely.
And so when you think about how much this affects your quality of life and your overall health, I think it's really worth it.
Thank you. I absolutely agree with that. And, as a PT who's done this for over 20 years, I am so thrilled to be working with an organization that really sees how important this is, and being able to walk beside physicians and say, we are going to be able to help you with fill in the blank, with pelvic pain, with, perhaps pregnancy-related pain, with incontinence, with constipation. I mean, it goes on and on. And I'm super thrilled to be walking beside you. Yeah, definitely.
Well, I feel blessed too to be able to have you and your team here as a resource for our patients. You brought up pregnancy. I mean, even pregnancy-related pain, for help with delivery, right? Like learning how to control and relax and open those muscles in your pelvic floor can help when you're pushing, can help with your recovery after you have baby. There's a lot that you can help with. I wish it was more of a routine part of the care that all women had, during pregnancy and after.
And you're speaking to my vision. You are really speaking to my vision that we are able to be that resource for any patient, whether they have, if they're not having pelvic floor pain, perhaps, or just pelvic pain in general with pregnancy, perhaps it's backache. Perhaps they've just had this nagging backache,
that hip pain right? Yeah.
And we can get in and assess, just because of our expertise in musculoskeletal disorders, and therapists that are specifically trained in OB understand the role that the hormones play on the musculoskeletal system, that relaxin is taking effect and it's loosening all of this up, for obvious reasons. You're going to deliver this sweet little baby into the world, and you want your pelvis to be able to expand, but at the same time, we need it to be stable. And so if your patients are coming to you with this, man, I'm having this nagging, it wakes me up at night, I can't roll over, getting up out of that bed is very painful for me. Those are obvious, triggers that perhaps a pelvic floor or a PT could help with alignment of the pelvis, stabilization, which I'm hoping that we're going to have time to do some exercises, kind of demonstrate those for stability of the pelvis. But, keeping in mind that this young lady is also going to be delivering a sweet little baby in, a period of time, we're going to talk with them about the importance of Kegels. We're going to talk with them about the importance of being able to open that pelvic floor, so that they hopefully can recall when you're then seeing them in the hospital to deliver that sweet little baby, how that can ease the delivery of a child, perhaps. Those positions, those stretches, those stabilization exercises that they've learned.
Yeah, it's awesome.
Yeah.
So pooping problems, peeing problems, pain problems, pregnancy support, I mean, there is so much
Postpartum.
Postpartum support. There is so much that pelvic PT can help with. And I am hoping today, can we do some exercises together?
I think it would be great.
Cool.
The ones that I've taught you, I think it would be great to demonstrate, because that will cover a lot of what we've discussed, and it's things that it's easy to do at home. Not any fancy equipment needed. That's the other beauty of these exercises that I'm hoping to be able to demonstrate.
Awesome, let's do it.
Dr. Ohs, thank you so much for being available to come down here and be able to demonstrate to everyone about how pelvic floor evaluation would go, as well as the exercises that we would introduce. So with the pelvic floor evaluation, we would have you in a private room like this, one-on-one with your therapist. We would use sheets to make you comfortable, to feel covered. We would make sure that before we even start the evaluation, that you are agreeable to the evaluation. We talk about all those histories that perhaps are being seen for. But this would be a similar type of setup for that patient, and then making them as comfortable as possible with that first exam. And then once we do that first exam, then we can start them on a home exercise program. So some of the exercises that you're going to help me to demonstrate today would be some of the exercises that we would actually start pelvic floor patients doing, not just the Kegels, as I mentioned earlier. So would you mind going ahead and laying on your back for me? And so with Kegel training, we want to incorporate the Kegels in most of our exercises, but also making sure that we're breathing through our exercises. So we're not going to ever hold our breath during any of these exercises. And I would instruct a patient to go ahead and Kegel. And as they're Kegeling, we might start with, say, a small ball that can go between the knees. And then you would squeeze that ball, Kegel, and then go ahead and do a bridge. So now what we're doing is we're incorporating all the support musculature, and now relax back down. You're breathing through that exercise. You're not holding your breath or adding any of that pressure into the pelvic floor, which is so important. So we may start a patient with one of those exercises. This one's actually one of my favorites. We would move the ball actually down towards your ankles, and you would grab that ball with your ankles. We, in therapy, love to use gait belts for a number of things, and at home, a patient may not have a gait belt, but they could use a belt that they would use around their pants, as an example. And we would secure the belt around your knees to give you a little bit of an isometric contraction of those hip muscles. So again, I'm going to ask you to do a Kegel, and then make sure we're breathing through this exercise. You're going to separate your knees against that belt while we're still Kegeling, as well as then squeeze your ankles against the ball. So you should be able to feel a number of those pelvic and hip muscles.
Strengthening
yes. And then you would hold that for a specified amount of time that your therapist would give you, and then you would relax. And then there would be a repeat of those exercises as well. So that is one of my favorite pelvic stave exercises to.
That's a good one.
That's awesome.
And this is going to help my pelvis get stronger.
Yes.
It's going to help with the leaking problem.
Absolutely.
And just feeling better in general.
Right, and to stabilize those pelvic bones. And you can even do this in pregnancy up until that certain point where laying on your back is not really recommended. But then we can move that patient into sitting, for example, to do those exercises.
Awesome.
Another one that I really enjoy having patients do, although they might not enjoy it as much, is using TheraLoops. These are resistance bands that apply a little bit of resistance. And so in this particular situation, if you'll go ahead and separate your feet just a little bit, and you should feel some resistance from that band, right? So now you're going to separate, and you're going to Kegel. We're going to breathe through this as you lift your bottom up, holding for a few seconds, and then relax back down. And then you can relax your legs a little bit. There you go. And then we would repeat that a few times as well. So a lot of what we do is incorporating the glutes, the thighs, the hip muscles, abdominals, and even with our pregnant patients, we can still do a number of these exercises. Another one that I enjoy, actually, we're going to put this back on, is by having you roll to your side.
Okay.
And we would do clams. All right. Yeah, so you're going to roll to your side this way.
Okay.
And clams are, again, an important exercise to really help stabilize the pelvis by activating more of the glute medius. So you're going to lift that top knee away from that bottom knee. And that is a, yes, there you go.
Okay.
That's very advanced when you lift the ankle up too.
Yeah,
you feel that? Awesome. You would hold for a specified amount of time.
And I'm Kegeling while
Yes,
I do this too,
yes,
right?
yes.
So I'm engaging all those muscles.
And then you're going to relax, and you would do a certain number on that side, and then I would have you roll to the other side as well to also strengthen the other side.
Awesome.
Yeah, and so now I'm going to have you sit up on the edge here. We're going to keep that band around your legs. And here's another fun one. Again, this would be one that even pregnant patients would be able to use as a strengthening exercise for those muscles. So now we're going to have you do a sit to stand. So you're going to separate your feet a little bit. Excellent. Make sure that your knees aren't together, but bring them forward. And now you're going to lean forward and Kegel as you stand. Excellent. And then slowly lower yourself back down. Kegel, Kegel, Kegel. And now you can relax. And then you can repeat that a certain amount of times. And then another favorite of any physical therapist are monster walks. You remember monster walks? So monster walks, we can keep the band at the knees. When you really advance, you can go down to the ankles. And it's side to side steps. And we kind of maintain that partial squat. That's perfect. And why we maintain that partial squat as we're Kegeling is it really helps engage that core by keeping our knees soft and our hips soft. Excellent. Excellent. And then if you'll turn and face that direction, you'll do forward so it looks like a skater. There you go. Yes. And then backwards. Skating backwards.
Silly.
I know. That's when we call them monster walks, because monsters are silly. All right. And then if you'll come forward just a little bit and you can have a seat and I'll help you with that off. And then another one that I like to really work with the pregnant patients on uses a Swiss ball. So that's these large exercise balls. And what you're going to do is have a seat right here on the ball, and you can sit with something next to you for stability. So sit facing that way again. And I talk to those pregnant patients about, really working on those core muscles to be able to help in delivery. So we might do some just gentle pelvic circles, which means that we're activating all those pelvic muscles to do a circle in the ball. We do reverse crunches, which that looks like this. So if you'll take your pelvis and you just kind of roll forward on the ball with your pelvis, and you'll lean your shoulders back. You feel that engagement in your abdominals?
Yep.
Perfect. And then come back up. So it's not a difficult exercise. It's not like I'm asking you to do a crunch. It is just simply don't fall back. And it engages the core, so pregnant patients can do this to really help keep their abdominal walls strong. And it helps with delivery as well. So getting used to, you can do gentle bounces on a ball. That will help with the Kegels. So this is another favorite tool for PTs to use for pelvic floor rehab.
Well, thank you so much for showing these. I think that it does make a big difference. And
I appreciate it very much. Thank you.